and welcome. Today I am presenting a career path in healthcare that combines exercise science, patient care, and chronic disease management. Clinical exercise physiology. A clinical exercise physiologist uses structured exercise as a form of treatment for patients with heart disease, pulmonary conditions, diabetes, and other chronic illnesses. This is also a career path that is ideal for individuals who are interested in healthcare, human movement, and helping others improve their quality of life through safe and effective exercises. Some of the most leading and supporting organizations that support clinical exercise physiologists is going to be known as the American College of Sports Medicine, American Association of Exercise Physiologists, and also the National Strength and Conditioning Association, which provides certification, pathways, network opportunities, and also ongoing professional development. Some of the most common volunteer opportunities that can happen within the field before a person commits to that actual path and career path is typically hospital cardiac rehabilitation departments, physical therapy clinics, community health programs focused on diabetes and also heart disease prevention, some senior living facilities, and others known as your local YMCA. Of course, these opportunities will help you to understand that exercise can be used as a medical treatment and not just fitness. Some areas of study that are required for the program as far as clinical exercise physiology is where people can get bachelor's degrees in areas of exercise science, kinesiology, or any other related fields. Also, they may pursue master's degree for clinical roles, and some of the coursework that is included is human anatomy and physiology, exercise physiology, clinical exercise testing and prescription, biomechanics, pathophysiology, which is the study of disease. You have nutrition and metabolism. You have exercise and research methods and with statistics, and also health assessments and risk screening. What would be the typical dream job for clinical exercise physiology would be hospital cardiac rehabilitation or also pulmonary rehabilitation programs. Of course, these typical responsibilities will include conducting stress tests and health screenings, designing individual safe exercise programs for patients with cardiac disease, monitoring heart rate, blood pressure, and oxygen levels during exercise, educating patients and members of long-term lifestyle changes, working closely with, of course, physicians, nurses, and also physical therapists. And of course, you'll typically always document the patient's progress and any adjustments made to their personal treatment plan. Of course, the role does require clinical judgment, very, 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 very high level of attention to detail, and also compassion. The academic program that directly prepares you for this career would typically be exercise physiology, pathophysiology, the exercise clinical testing, anatomy and physiology, and also nutrition. To gain success, of course, students do need to have the own hand practice as far as experience from internships, practice with communication skills, of course, preparing for the certification exams like the ACSM, CEP, and to take lab courses seriously and seek, of course, real life, real world exposure whenever it's possible. As far as networking and mentorship, as far as the field, it is very essential. Of course, your clinical supervisors and also professors can help to connect you to hospital internships. Hospitals often hire their own interns through that program, hire on after. There are, of course, professional conferences that allow you to meet different clinicians and have some experience and find out about their experience. which mentors can also guide you through, of course, the certifications, job applications, and of course, clinical decision making. So, of course, the strong relationships within healthcare can lead directly to the career advancements and any other job opportunities. As far as a Christian worldview, it emphasizes caring for other patients as a person with dignity and of worth, reviewing healthcare as a form of service to others, showing compassion, patience, and of course, encouragement during any type of recovery. As far as promoting the healing of the whole body, mind, spirit, and soul. Also, making ethical decisions grounded in, of course, integrity and the care for human lives. And then in conclusion, just to sum everything up, clinical exercise physiology is a meaningful and growing healthcare career that blends science, rehabilitation, and also patient care. Of course, the opportunity is offered to help people to recover from some serious health conditions to improve their long-term quality of life. Of course, if you are passionate about healthcare, exercise, and making a real difference in this career path, then it will be the right one for you. So thank you for your time and also for your consideration. Thank you. Have a great day.